Assalamualaikum. In the previous lecture, we are studying anatomical position. Now we continue our lecture from mm, there. The term anterior and posterior. The structure situated nearer to the median plane of the body than is said to medial to others. Similarly, structure that lies farther away from the median plane than another is said to be lateral to the other. The head eyes are the later to nose and later to medium. The term proximal and distal describe position relative to the core root or attached end of a reference point. Proximal is closer to the core and distal is farther away from the core. For example, in the upper limb, the shoulder is proximal to the elbow and the hand is distal to the elbow. The term superficial and deep denote position relative to the surface of the body or a given structure. Superficial is closer to the surface, whereas deep is farther away from the surface. The skin is superficial to the ribs, but the heart is deep to the ribs. The term internal and external are used to describe location relative to the center of a structure or space. Internal is inside the structure, external is outside the structure. Example are thoracic cavity is an internal space in the trunk of the body where the skin is the external layer of the trunk. Elliptical and contractile are terms referring to the position relative to a reference side of the body. Elliptical is on the same side as the reference point and contractile is on opposite side from the reference point. The right eye is ipsilateral to the right ear. However, the right eye is contractile to the left ear. The supine position of the body is lying on the back. The prone position is lying face downward. The term afferent and efferent refer to direction flow related to a face flow toward the reference point, whereas the afferent is flow away from the reference point. Venous blood flow in afferent to the heart and arterial blood flow in efferent to the heart. Term related to movement. In musculoskeletal, movement take place at joints. A joint is a site where two or more articulate or come together. Some joints have no movement, suture of the skull. Some have slightly movement, the superior fibular joint, and some are freely movable joints, shoulder joint. These are the movements. Some movements which show flexion, relaxation. Flexion is a movement in which a joint angle is decreased during motion, occurring as a sagittal plane. Extension is the opposite movement in which the joint angle is increased. A sagittal plane flexion of the elbow approximates the anterior surface of the forearm to the anterior surface of the arm. Extension of the elbow is the reverse motion. Procedurally, as in the case of knee joint, also flexion typically implies a relatively more powerful anti-gravity movement directed toward the embryonic ventral aspect of the body. Dorsiflexion and plantar flexion, a special term used to simplify description of the movement of foot. Description of the movement of foot. Dorsiflexion refers to lifting the top of the foot superiorly toward the shin. Plantar flexion refers to the moving of the sole of the foot fairly ascending the toe. These points will become clearer in the following chapters on the back and limb. Lateral flexion is an imprecise term sometimes used in clinical setting. Refers to sideways binding movement of the trunk coronal plane. However, abduction is the more correct term, the one that should be used. Inversion expression or special term used to describe certain movement of the foot. Rotation is a term applied to movement of the body around its long axis. In last 10 seconds, we are now discussing anything. So our lecture is done here. Any questions?